J'appelle maintenant la prochaine personne conférencière, Dr. Iveta NAGYOVA. Thank you so much.
Thank you very much, Guillaume. But I would like to invite also the other actors in this workshop. So Simon, Mo, and Falko, please come to the stage. We are now having a different setting. So this is going to be a workshop, a 30-minute workshop with all the speakers, and I will introduce a little bit the topic. The topic is entitled Health 2.0, the mRNA, AI, and NPI Revolution. Please take a seat. And what we are going to do here today is to talk a little bit about the potentials for innovation. And let me start with the statement that technological and methodological innovations are reshaping the foundations of global health. Advances in mRNA platforms, robotics, artificial intelligence, and other novel approaches to non-pharmacological interventions offer unprecedented opportunities to enhance prevention, prediction, and response capacities of the health systems. And this workshop will examine synergies among these transformative domains, focusing on their scientific, but also ethical and implementation domains. And we will start with the introductory, with setting the scene by Mo, the WHO Europe Public Health Innovation Lead. He will dive more into details about the innovation agenda of the WHO European region, and then I will invite Simon and Falko to reflect on his speech and also to bring their own perspective from their field of interest and expertise. So, without further ado, please, Mo, can you come to the stage?
Oh, yeah. Thank you so much, Iveta. What I'm going to just show you is, I think it's going to build from my morning statement, just to take you through the vision of the regional director, Hans Klug, in terms of promoting innovation for public health. Like I said, one of the things that he has done particularly is to fiercely protect innovation from all the happenings that is taking place at not only at the European region but also globally. You know, we are losing our workforce, about 20% to 25% of our workforce are being let go because of the global, budget cuts on public health, on global health, actually. So this is a huge commitment for the regional director, and what he has seen. Like I said, it's just the slide that are not coming, but what we've realized, and this is also something that I realized coming from Africa, when I first joined WHO in the European region, I realized that it's a conundrum. You see all these emerging and overlapping crises from climate change, rising non-communicable diseases, and probably you know that 90% of all deaths in the region actually are caused by NCDs, and they are attributed just to 4 NCDs, which is cancer, cardiovascular, diabetes, and chronic respiratory diseases. And we're seeing also a pandemic, which is actually regarded as a pandemic to do with aging population. And on the other side, the European region is inundated with all the creativity and the ingenuity. And we are talking about in excess of 250 innovation institutions, including innovation hubs, science parks. So last year, Iveta was there. We had the first ever meeting on innovation for public health, where we invited representations from these innovation institutions, just to try and understand to what extent are they engaged in public health initiatives. So, and this is something that when we invited all the representatives of these innovation institutions and engaged them in public health initiatives, and on the other hand, we also invited representatives of ministries from ministries of health just to matchmake and catalyze that discussion. And we were really amazed in terms of the interest from both sides because when we talk of the innovation institution, they have the resources, they have the expertise, they have the know-how, but they don't have really an opportunity to be closely engaged to public health. And this was the beginning of the formulation of the innovation strategy. So like I said in the morning, what we see is that the fast pacing of industry-driven innovation, from artificial intelligence, digital therapeutics, 3D printed devices, precision or personalized medicine. But on the other hand, we're seeing our public health system really lagging behind. And to some extent, we are seeing public health system being disrupted. I can give you an example, which is obviously not a non-pharmacological intervention or non-pharmaceutical intervention. We know that just a few years ago, GLP receptor agonist drugs revolutionized the clinical management of diabetes and obesity. And public health systems, they were not ready to adopt such a therapeutic intervention. It is only now that WHO is starting to come up with population guidance to ensure equity of GLP agonists. And I can talk about some of the innovations that are emerging from the technological platform, whether it's quantum computing and other, even mRNA technologies. Our health systems are still lagging behind in terms of how exactly to position our health system in such a way that they will effectively harness innovation for public health. And this is exactly why, as WHO, we were looking closely to see where can we position ourselves and contribute to promoting innovation, especially innovation that are going to address public health needs, making sure that equity and sustainability is at the core. And that's why I was saying in the morning, we really want to work closely with the Ministries of Health to identify, some of the areas of public health challenges where innovation can really make the most impact. And this is not an easy exercise. Doing a needs assessment, even horizon scanning, is even setting the agenda is one of the things that we really want to help countries to do. We want to connect our public health authorities, ministries of health, with these innovation institutions that I've just talked about, and to create that dynamic partnership, because it's not about innovation hubs or even some of the tech companies that are presented here sitting by the corner, and they are not necessarily being involved in articulating in where the demand of public health is located. And that's what we want to close as an implementation gap. And of course, trying to catalyze those and address some of the systemic challenges or bottlenecks that we have actually seen that impede on the scaling up of innovation at country level, whether it's to do with the lack of workforce capacity in the usage of next generation innovation, whether it's to do with reinvestment models, whether it's to do with integration of some of these innovations that we know works into public health system or into health system. So when we had this sort of frame, one of the things, like I was saying, last year we had this fantastic meeting where we brought together the innovation hubs, representatives from the innovation hub, and also member states representation. And if you can scan that code, you see that's a report that came out of that meeting. And we were actually very, very optimistic and forward-looking, because we realized that these are two constituencies that were working in parallel, but they need each other, and they didn't realize that they need each other. Then, fast forward, at this year's regional committee, we're going to present the first ever innovation strategy for harnessing innovation for public health. And we presented what we call a working paper last year at the RSC again, just to try and test the interest of member states in something like this. And the interest was just overwhelming. And now we are actually presenting this regional strategy for their consideration and adoption. And it looks basically on 5 domains, which may seem obvious, but they are not very obvious to many of these ministries of health. Because when we are looking at innovation, the first is on integrated innovation policy for public health. We know that innovation does not only happen in public health, it's actually at the interface of either science, industry, economy, and public health. And how can we make sure that innovation policies from all these different domains, they serve public health goals? And it's not as easy as I'm saying it. The governance and financing, we have also realized that financing for innovation for public health does not necessarily end up in improved health outcomes or closing the equity gap. And this is where we really want to work and work hand in hand with ministries of health to address. Capacity building is also another area, because we know the capacity for innovation is very much within the industry domain, but our public authorities don't necessarily have the innovation management skills that necessarily are required to harness some of these innovation. And innovation for sustainable impact, how can we make sure that we help these countries, like I was saying, scanning the horizon, needs assessment, and also testing and piloting, sandboxing some of these innovations, and making sure that equity is also at the center, and inclusion is also included in that. And of course, collaborating platforms, which is really reimagining partnership. Because what we have seen, and this is an area where the Nordic countries, I think, are leading the way. In Denmark, where I am based, there is an initiative called Lighthouse Life Science Model, which is driven by the Danish Life Science Cluster, where they are bringing all these cross-cutting stakeholders from civil society, from industry, and also public health. It's really to come up to confront a public health challenge, whether it's obesity, mental health, and ensure that innovations that are funneled through that really are not only for the selected few, but will end up really making the population level impact. Again, with this innovation strategy, this is where we also draw the expertise of what is called the Technical Advisory Group. And I'm actually proud to say Iveta was one of the Technical Advisory Group members that, alongside the innovation strategy that we are going to present, they came up with what is called an innovation agenda. And that's why Iveta is so interested in the innovation agenda, because these 15-member technical advisory group, really they were very innovative, and they said, yes, you do have the strategy, but when it comes to few tangible and actionable areas, where can we target? Where can we start focusing our energy and resources toward? And this is where Iveta and crew came up with these 4 main areas, which obviously overlaps with the strategies that I have spoken about. But they are talking about quantum collaboratives. They were saying we want to see WHO and member states revolutionizing this partnership, reimagining partnership, like what we are seeing in Denmark through the Life Science Lighthouse model. Digital solidarity, how we want to see a commoditizing of data and digital. Not that data is only saving the few, but there are areas, there are pockets where it's actually coined digital invisible people. You know, we're talking of elderly people. We're talking of those that are in the rural areas. How can we make sure that whatever is informed by data saves them from an innovation perspective? Accelerated capacity is also another area. We're looking mostly around capacitating healthcare workers, but not only healthcare workers to use technology, but to integrate behavioral science as well as making sure that they take into consideration some of the social factors, because we know technology can only work better if it's contextualized by motivation and also some of the cultural nuances that you need to take into consideration when you are rolling out a technology. And incentive resolution, which I talked about, we are seeing so much effort around incentivizing some of these private sector. But if you incentivize them, are we going to see improved health outcome? We have seen with the mRNA technology, where there was so much money that was poured into some of these industries. In Africa, there was lack of access in the initial stage of COVID-19. How do we really make sure that when we incentivize private sector, it's not just about socializing risk and they are going to privatize the profits, but the ministries or government should really be at the core of driving this continuum of development until usage. And this is what I think I can say for now with respect to our vision and making sure that innovation is not just a buzzword, but innovation should be actionable. And also like I said before, we encourage you. I'm also appealing to you on behalf of the regional director to come work with us. We are very much interested in innovation as we want to reimagine global health, and we know the potential of innovation in all this. Thank you so much, Iveta.
Excellent.
Thank you.
Thank you. Thank you so much, Mo. I think it is really important to understand the wider context and the agenda of the WHO on innovation, WHO Europe specifically. You are right, I'm very excited about innovation because actually within the current overburdened and over-financed healthcare systems, we have no other solution. We have to be innovative. And I have 2 excellent panelists here, Falko and Simon. And I would like to ask firstly, Simon, how do you see the innovation? Your area of expertise is AI, mHealth, and behavioral science. You try to bring all these things together. And so what is your reflection on what you have heard from Mo now, and how do you see the future? So we had the, so to speak, helicopter view on innovation, and now I would like to ask you to zoom in more, also within the context of NPI, AI, and mHealth, and these issues.
Okay, thank you very much. Yeah, just a small question to fill in there. Okay, I'm going to start with one comment, which is obviously a large driver of a lot of the innovation we're seeing at the moment is the AI components, and you know, just to flag, AI is not a thing, it's a multitude of things, so I use that term very, very broadly. In the context of the kinds of interventions that we do, there's a lot of talk at this moment in time about where does that fit in, right? And I think there's a few things there. There's the first, how can we leverage that to make our interventions smarter? How can we make them more tailored to individuals? So help drive the flow of interventions. But then obviously we've got this issue as well of delivering the interventions. So we're starting to see chatbots become front end of actually how some of our interventions are delivered. So there's huge potential, but there's always the big but. There's a couple of things that are worrisome at this moment in time. Number one is the speed at which these kinds of tools are changing. And our incapacity to have, we don't really have any good models about how do we test that, how do we validate its efficacy, how do we validate its safety before then implement it. And so talking about innovation, right, one of the key things about innovation is being able to incorporate the things that are being developed, but at the same time we have to have a huge amount of confidence, especially in the healthcare world, that what we do incorporate works and is safe. And so that I think one of the largest challenges is understanding how to do that part of it. And I think before we sort of go whole hog into throwing things into systems, we need to sort of tackle that piece and tackle it in a very meaningful way. And then the final thing I'll say is just once we've managed that, the other thing, the huge role that I think behavioral science has in this process is actually the systems change management piece.
Yeah.
Right? How do we loop that stuff, and how do we manage people through that change as well, which is a whole other piece that we don't really understand.
And how do you see the interlinks between NPI and NI? Because in the definition that we presented this morning, AI was not mentioned. So how do you see the role of artificial intelligence in non-pharmacological interventions?
As I say, it has huge potential. I think I think it's actually going to be quite a while before we really realize any significant potential of it. And the reason is, what most people forget is at the end of all good AI is a gold standard that is reliable. Right? So if I think of the medical world and I think about where AI has been really successful, it's been in imaging. And that's because you can get a bunch of very highly qualified radiologists to sit in a room, look at the same scans, and with a high degree of consistency, they can spot where the problems are. So your gold standard is really good.
Yeah.
Virtually every aspect of medicine, we don't have that same level of gold standard. So your outcome that you're leveraging against is pretty fuzzy. And then AI is never perfect, so there's a fuzziness that's on top of the fuzziness. So I think we have a huge challenge. And so one of the things I worry about is people thinking that this is going to be the panacea. People already using it as a panacea. The amount of uptake of large language models by physicians is increasing at an exponential rate. And this could be, it's problematic because it's not being managed. The implementation of this is not being managed correctly.
Yeah.
So that on a certain scale, this has got huge benefit, but it's got to be right. Exactly. We've got to understand the limits of it, which
and the ethical
doing a great
aspects,
job.
and actually also the social aspects, isn't it? And now I kind of like bridge over to Falko, because Falko's areas of expertise is behavioral and preventive medicine, and also exploring how new technologies intersect with behavior change and social determinants of health. So Falko, how do you see the implementation science of NPIs and also digital innovations, how this can be aligned with public health and especially policy? So if you could expand a little bit of what you said in the morning, reflecting on what Simon said and what Mo said as well, so from your perspective.
Thank you, Iveta. before going to the issue of policy and implementation, I think it's important to say that it's a huge market. Yeah? And it's a market in that, I know in my country, it's very actively considered to be the market that will create the jobs of the future. So a lot of politicians think that is why innovation is important. But of course, it's also a market in that people have different access to health and health care. And there are massive inequalities.
Yes.
And I think, interestingly, for all three examples, Mo, that you mentioned in your presentation earlier on, these are all examples where people had early access if they had the money, and late access if they don't have the money. And that creates this sort of situation that we often discuss. Intervention-generated inequalities. The wealthy and the rich can buy innovative weight loss drugs early on. They understand early on and have access to innovative vaccinations. And of course, artificial intelligence is not something that we can, technically speaking, regulate in many areas.
Right.
So people will buy it. You build it, they will buy it. So it is a set of innovations that massively accelerates inequalities. And I'm leading one of the 6 national digital innovation hubs in Germany, and that is what we see across applications. Across applications. And that is the biggest worry, because we improve the health of the people largely by improving the health of the ones at highest risk. I think that's a really important point I would like to put first, and that worries me a little bit in all of these developments. And then, of course, famously, I've started the proceedings today by telling you of my favorite examples of implementation, which took 25 years. I think in any of those interventions, 25 years would be a push. But of course, we have to accelerate the implementation process now by force, because in 25 years, none of these interventions is up to date anymore. And that, of course, creates a lot of issues in the regulatory process. So we all have different regulations, what constitutes sufficient testing for efficacy and for safety, for something to be supported by health insurance systems, for example. How do we get there? What criterion can we take? And how can we deal with the fact that even in a regular evaluation, we probably go through 10, 15 innovation circles of the technology? That means if I start a trial of a large language model-driven intervention, when I end the trial, they have iteration 15 of it. And I think that is something we need to bear in mind. So we need to become clearer on regulation. We need to become clearer on the risk that remains involved in implemented systems. And we need to balance the difference between self-paid and communally paid interventions, both within countries as well as globally, to make sure it doesn't lead to a further acceleration of the inequalities, which at the moment is the single biggest threat to our healthcare systems and also perhaps a significant threat to our democracy.
Yeah. You raised several issues which actually inspired me. First of all, the shortening the period between research findings and implementation in practice. So we can do that through knowledge translation, right? So with specific procedures, it can be shortened to 3 years if we are successful, if we are collaborating with the policymakers and we do everything right. But with regard to policy, actually we had a very nice discussion with Eve during the break that, you know, there is a strong push from the pharmaceutical industry to kind of like actually push the drugs instead of non-pharmacological interventions because they make better profit, and especially when we speak about health insurance companies. And actually I'm talking about real-life examples. So we have in Slovakia, we have a big cardiology institute where they do surgeries for patients with cardiovascular diseases. And one of their medical doctors was very enthusiastic about secondary prevention. He created a program and he had a collaboration with the health insurance company. But the leadership of this hospital stopped the program because it is not so, because it's too cost effective, so to speak. So, you know, so I would like to hear how we can overcome this problem actually, you know, the influence of pharma companies, the commercial actors, and also it's a question to Mo. What you as the WHO can do in collaboration, let's say, with Ministry of Health. So firstly, Falko, and then I give the microphone to Mo.
Okay, well, that's, of course, a typical question.
If I can ask you, we're running
this is the final.
Concluding remark, very short. Please.
Okay, commercial interests are always important. Important is to highlight the added benefit of these interventions, not only in terms of their business model, but also to the people. If artificial intelligence is there to deal with a lack of supply of regular health services, then people perceive it to be a substitute. If it offers additional benefits, in particular in terms of personalization, which is even more difficult in terms of the regulation, then people will have a sort of different push on implementation because it adds an added benefit rather than replacing something. So the optimization needs to be focused on the health of the people, not on the business model of the people who wrote the algorithm.
Yeah, no, thank you so much, Iveta. I think this is a very, very pertinent question. And at WHO, this is something that over and over, and it's actually making us even more interested in supporting countries. We have seen that when it comes to innovation, public health has been a passive beneficiary of innovation, and they relegated innovation to industry. And of course, the incentive of industry is to make money. There are no questions about it. I can only do something that make economic benefits. If, on the other hand, the market is not incentivizing me to produce what it wants, but at the same time incentivizing me to do that. So we see that gap. That's why we always say the government should be on the driving seat in shaping the innovation agenda and incentivize it and making sure that their policies, their strategies is to work hand in hand with those industry and promote those non-pharmacological interventions, because there is an incentive attached to it and there is a policy attached to it. I think we can make progress around that.
Yeah. So actually, this session was supposed to be just a kind of like appetizer and food for thought. So exactly, I wanted with this session to all of us make sure that we understand that how NPI fits into this wider context of innovation and healthcare in general, and to understand that what we are fighting against, so to speak, or when we have allies, so to speak. So thank you very much once again for excellent speakers and panelists today, and I really appreciate that you accepted our invitation to this Congress and to this workshop specifically. Thank you, and thank you, Guillaume.